All right, let's go ahead and get started. And so, just as we mentioned at the beginning, the exam analysis will take place on Friday. Thereafter, grades will be posted. So let's look at where we are. This is week 4. And it just seems like after week 5, which is next week, seems like things just kind of go real, real fast. It's the same time, but it just seems like it. So just be mindful of all the things that you have to do. Work, school, fun, play, family, all of those things. Look at your schedules and rearrange, delete. Here we go. Here we go. Whatever that's going to work for you. So we are here in week 4. We just took exam 1. Then week 5, you do have a quiz when you come back, quiz 3. Because remember, the weeks you don't have an exam, you have a quiz with the exception of 1, but it's further down. And then we're together next week to cover more content. But then week 6, you have exam 2. Dr. Mary has already posted. If she hasn't, she will probably no later than tomorrow. The dates for the live exam reviews, which will be, essentially next week. Because the month ends. So yeah, so that's where we're going. Quiz next week, which is week 5. And then we'll go over more content, and then exam 2. Then after exam 2, there's a little time between exam 3. The first 2 exams go by really, really fast. They come up real quick. So be sure that you are reviewing the weekly recordings, listening for the content, the concepts, verify what you think you know about it. And if you're way, way off, put that at the top of your list for the concept that you need to start reviewing first. Those concepts, as you hear them and it seems like, you're right on point, and put them at the bottom of the list. Go back and look at everything, but those things you won't have to look at first. Okay. All right. So we had a little activity, but I think we can do this as whole group. It's going to be individualized, but we're going to do a timer with it. So what you're going to be asked to do is we'll give you 90 seconds to look up a term, a concept, and then be able to, in the chat, place what is your understanding of that concept. So I'm going to share my screen here. Let's see. The other Zoom is still trying to convert. So it keeps popping up. So hold on, let me share my screen here. It's right here. So our first term that you need to look up will give you 90 seconds. Well, okay, from current slide. Non-malfeasance. So timer is on. Open your resources. Look for now non-malfeasance. And then also put in the chat 3 minutes. Like, what is your definition of it? Put it plainly to us, paraphrase it, look up the term non-malfeasance. I put my timer on. So what are you being asked to do? To look up this term, go through your resources, see what does this mean, scan it, and then paraphrase it. Put your paraphrase definition in the chat. And send your responses out to everyone so everyone can see it, not just to me. So we are defining and we're discussing. We're discussing it non-verbally right now in the chat. So look up non-malfeasance in your resources and then paraphrase it. Don't put exactly what you're reading, but paraphrase it, put it into your own terms. Place it in the chat. We still have 1 minute, 1 minute and 7 seconds. Okay, we have 52 seconds. I'll stop sharing so I can look at your responses here. So place your responses in the chat. Got it, got it. I think we got everybody. All right, let's see what we have here. You all did you all didn't need the whole 3 minutes, so I'll adjust it next time because we still have about 10 seconds left. So, all right. So you all have given us some good definitions here. Oh, man, this PowerPoint, yeah. Okay, there we go. Man, I didn't skip it too fast. Okay, too far. So now non-malfeasance is that obligation. We are signing up to cause no harm to our patient. You know, that includes, causing no pain. We want them, some people are never pain free, but in the event that we see that something, therapy may be caused. They may not be ready for that type therapy right then. You got to go to therapy. You have to go because we have that doctor's order. We may want to delay it later that day, or it may be, delayed a little bit in reference to when they actually get the therapy. But it is causing no harm to that patient. So you have to think it through. You're like, okay, is what I'm getting ready to do, is what we are doing. Are these things causing our patient any harm? Okay. And so you all's definitions were right on. You were right on with that one. So that would be a term. Not sure what's going on with this PowerPoint. You all, let me see. I'm gonna go to the other PowerPoint. So does that just only include the doctor, or does that include us as well? Causing no harm.
It includes us as well.
Exactly. So an example I have here, the nurse that has lowered the bed in the lowest position, the call light is in reach after completing a client's care. We say that all the time. That's just a little thing. Call lights in reach, beds in lowest position, and belongings in reach as well. So that's an example of doing no harm, because we do know in the event that that bed is left, that it is not in that lowest position, and someone just happens to fall out of bed, then more harm can come to that person. And when you compare if they fall out of the bed and that bed was in the lowest position. Now, I know in a lot of our facilities, there aren't any bed rails. So you really want to make sure that that bed is in its lowest position. Even if the patients would have used the bed rails for repositioning, there are a lot of facilities that bed rails are not there, especially the long-term care facility. That's what I'm referencing. Because I guess the politicians, they're saying, well, hey, at home, unless there's special circumstances, people don't have bed rails on their beds. So you healthcare providers figure out a way to take care of people without having bed rails, because what they said was that the data showed that the bed rails cause more harm. They had broken necks, broken arms, all kinds of things that you would never think would happen because of a side rail being there. So you definitely want to make sure that bed is in that lowest position and that call light is in reach. Okay. So our next term is beneficence. So let me set the timer, do the same thing. Look at your resources, read what it says, place in the chat, and then you all look at others' responses as well, because the more that we see this, a connection is made. We have a better understanding. So beneficence, that's what we're looking at. 3 minutes. Let me set my little timer in the chat. How do you remember or understand what beneficence is? Well, I like your definitions. They're pretty good. Keep them coming. All right, let me share my screen. Best interests of the patient, being kind to others. All right. All right, let's see how we did. Our time isn't up yet, but I'll give it 30 more seconds because we still actually have 2 whole minutes left. So go ahead and be responding. And that way, even if you place an incorrect answer in the chat, once you see the definition, you still learn. You learn, well, oh, I was a little off. So then that would be one of those concepts you put at the top of your list to go back and look at. Okay. All right. So beneficence is the obligation. We're obligated. We sign up to take care of people, to act for the benefit of the patient and support. And this includes moral rules to protect and defend the right of others, prevent harm, remove conditions that will cause harm. For example, going back to the bed being in the lowest position, we know that we have a person that needs 2 persons assist, but they're trying to always get up out of bed. They don't have bed rolls on the bed. We've tried the different little things that people have designed and created, little bedfellows and different things like that. This person still tries to get up. They've had falls. And so what would be the next thing that we need to do? That bed's already in the lowest position. We would need to probably, that facility, if that patient's going to stay there, they're responsible for that person's care. So they would more than likely need to invest in a bed that's on the floor. I don't know if you all have seen them, but their beds are literally on the floor. They're in the really, really lowest position. So, but that would be something that we would need to do. Okay. And then what about, here's another example. What about if, the medication that you're giving, if the therapy that the patient is receiving, we see that it could be the medication. Let's talk about the medicines, for example. Patient complain of pain. They do have pain. But once the patient takes the medication, they're completely knocked out. They're down for the count. They don't want to wake up. That was our little timer. They don't want to wake up for meals to feed themselves. It's almost like they have a change of status because normally this person is independent, but with this medication on board, they're not able to do their simple task of ADLs. So what do? We communicate to that healthcare provider, hey, the pain is controlled, but we're seeing where they're not able to do anything else. They're not even able to talk to their family members, to put the call line on and ask for assistance and things like that. So the orders that are questioned, so we would have to bring that to their attention, and we question it in a respectful manner. And so even if lab results, some certain medications are lab driven, and we see that the patient's labs are, we can say that they're normal. The labs have trended back to normal. The patient is still on whatever medication. Have that conversation just to make sure, hey, we see that the labs are back within a normal range. This patient still need to be on this medication? And the answer could be yes, but we're questioning that order to ensure that that patient, the best thing is being provided for that patient's being protected. And that's, the position that you're, assuming as being that leader, that nurse leader. All right, so let's talk about autonomy. Place it in the chat. Start the timer. Review your resources. Go through your files. Place it in the chat. Autonomy. What part of that word do you know? Auto. What does that mean? So autonomy, go through your resources and tell me what you think autonomy is. Autonomy, our timer is set. Okay. Okay. All right. So we have make your own, the patient makes their own decision, and someone took it a step further, an informed decision. And sometimes those could be different decisions. If I don't have all the information about whatever it is, I'm not making an informed decision for myself. Okay. Including the patient in the decision making process. All right. Being self-governing. Let's see, how do we do? Keep them coming. Make sure you put your response in there and you all take a look at it. All right. So autonomy, auto, we know that means self, is defined by the right to self-determination and respect the individual's rights to make informed decisions. So yes, they made that decision, but did that family member, did they have all of did they have enough information, to make a decision that they actually made? So you want to ensure that they do. They're having questions about something. Even though they've come in and went over the procedure with the patient is still keep asking you, well, what would you do? And they're asking you questions that's outside of your scope of practice, which we'll talk about that here in a minute. You might have to ask that healthcare provider to come back in. The patient has numerous questions. They're really not clear. Are you able to come back in and go back over or just discuss more, go in more detail? Is there a video that this patient can watch so that they can make that decision themselves? Is it okay that the patient refuses a treatment? Is that okay? I don't hear you all. Am I on mute? Hold on.
Yes.
Okay, okay, okay. So yes, it's okay. That's a part of that autonomy. So the patients, they're not going to agree to everything we bring to them. They may even decide, okay, well, I want the surgery, but I don't want, if in the event that I need blood, I don't want to get a blood transfusion. They may say, hey, I want to get my labs done, because there are even some treatments out there, and the treatment is monitoring labs. A person to have a certain disease process, and they can choose not to have chemotherapy or radiation, and they call it surveillance. That's our little timer. They call it surveillance, where that patient say, hey, I want to monitor, I want to keep a check on what's going on with me inside, but right now I don't want neither of those recommended treatment options. So my treatment option I'm selecting is surveillance, and that is okay. That's part of that autonomy. Autonomy refers to the client's right to make their own healthcare decisions, the client's right to determine the course of action. The patient signs a permit for one procedure, but not the other. It is okay. Uh-oh. It is okay. All right, so let's talk about justice now. Tell me what justice is. Set my timer. We'll just give a minute, 60 seconds. No, 90 seconds. Delete. Let's do 90 seconds. So we're defining justice. How would you define justice? And while you all are putting the your responses there, someone did bring up, you have to start with the concept. So what is this question, or what is this concept, or concepts? It might be more than one that this question is talking to me about. And then once you get that, well, I know banana is a fruit that's, similar little shape, yellow, starts off as green, grows on trees. Then put it into context. Remember, one word can change what they're asking you about that concept. Okay, justice, treating all patients equally, to be equal and fair no matter what, no bias. All right, let's see what we have. and 9 seconds, but we're gonna go on. Let's see here. All right, and so justice refers to providing fair and equal treatment to all clients. The examples that are here, we know what justice is. So now we're putting it into context. If I were to ask you, give me an example of when justice is not being provided. So these are some examples. For example, the nurse overhears a healthcare provider saying that they will, change up the care because this person doesn't have insurance, or this person has insurance, but it's not enough to cover all these things that they want to do. So they're going to change specifically what their plan of care for that patient. If a client, for example, they need to join some type of support group, they might be, I don't know, Alcoholic Anonymous. And because we know that they have a issue with alcohol, then we don't treat them the same. We would normally do whatever it is we would normally do, but we don't, because we know this about them. No, justice requires us as healthcare professionals to treat everyone equal. Okay. All right. So the Nurse Practice Act, and I just want to hear your voices now. Let's switch it up. Let me hear from you. What is the Nurse Practice Act? What is it for? The Nurse Practice Act. Is it a person? No, it's a document that has things in it. So what is it? What are those things that are listed in the Nurse Practice Act? Let me hear from you. Voices. I want to hear verbal now. Let's mix it up.
So the
Like your
practice
scope of practice.
tells you the framework of what you're supposed to do, or what your scope of practice is within your state.
It is your to-do list. If it's not on that list, if it's not on your Nurse Practice Act, don't do it. And will you be asked to do things that are not on your to-do list, your Nurse Practice Act? Yes, you will. But it's up to you to know and become familiar with and it is different by state to state. And you could be licensed in several states. But you still, when you're practicing in that state, it is your responsibility to know what's on your to-do list. Your Nurse Practice Act is a document that has have do's and don'ts on it. It guides what we do. It is our blueprint. For another way of saying it, it's our blueprint. It's our to-do list. All right, yeah. The Nurse Practice Act guides the nursing practice of every nurse, no matter which state you're in, and they vary depending on what state you're in. It is a guideline of what actions a nurse can legally undertake, and it is guided by the state statutes, and it is considered the law. So when they call 1-800-lawyer, what are they going to refer to determine if you did something you were not supposed to do? They're going to refer to your Nurse Practice Act in that state. And if it says your to-do list, told you to do A, and you chose to do something that wasn't on the list, then you are liable. Charges can be brought up against you, monetary, jail time, all kinds of stuff. So the Nurse Practice Act is your to-do list. Now tell me what this beneficent paternalism is. It's a different word we don't hear very often. So we hear, what do we know? The word kind of benefit is kind of in this word. So beneficent paternalism, what is that? Let me hear from you. Let me hear your voices. Beneficent paternalism.
I think it's when the provider makes a decision based on the patient's best interest.
And so does beneficent paternalism, does it promote autonomy, or does it go against that person or their family member's autonomy? Does
it acts against it? It
acts against it, but they're thinking of the patient's best interest. So yes, it's like, wait a minute now. But yes, that's exactly what it is. They're thinking that, for example, if a patient, family members have decided not to, for their child to receive some type of care. And the healthcare providers are like, wait a minute, I really think that this would benefit your child. And so the healthcare providers, they can petition the courts go and present their case. It doesn't mean that the courts will side with the healthcare provider, but it's just a step further to ensure that, we've exhausted all means with whatever's going on with that patient. So yes, that was correct. So it limits autonomy, but is in the patient's best interest. And it does not mean just because they go before those courts, does not mean that they will actually side with the healthcare provider. So it is telling the client what treatment option they should choose. And it's only implemented in extreme circumstances. It's not like an everyday thing that you hear of someone exercising this. And the example that we have here, a doctor seeking court permission to treat a minor against the parent's wishes. They can present the case, but it does not mean that the court will side with them. So negligence. Negligence is the failure to take proper care in doing something. An example is while assisting a resident to an activity room, patients go into the activity room. You're assisting the patient with the bed bath at the bedside. You had a patient in the shower room, patients in the dining room. And instead of the healthcare provider providing the care that's needed that moment in time, they're off doing something else. If they leave the patient unattended, they're right there with the patient, but they take a phone call, they're texting. All of that is not providing patient care. And as a result of it, the patient receives some type of injury. No matter how minute that it is considered as negligence because we neglected to do what we were supposed to do, take care of the person. All right, so let's stop here. Let's make sure that we understand these terms. So I'm going to pull up a Kahoot here, you all. Let's see. Let's see. Host a live. Let's make sure we understand. So go ahead to kahootit.com. It's loading. Just as soon as it loads, I'll show you the pin. It's still loading. Okay. Loading the game pin. Get ready to join. Go ahead. Okay. All right. Let me share my screen. And just log in with your initials. We're doubling down on our concepts to ensure that we've got them. 992-0652. All right. Log in. Let's go ahead and get started. Non-malfeasance. What is that? Okay. Do no harm. The obligation to do no harm. All right. You did pretty good. Beneficent paternalism. Okay. So it limits autonomy. It's done in the best interest of the patient, but it does limit autonomy. And it's only used in extreme circumstances. True or false? The Nurse Practice Act guides the nursing practice of every nurse. Okay. That is true. It does guide the practice of every nurse. Okay. True or false again? Negligence is taking proper care in providing the services that is needed by the patient. Negligence is taking proper care in providing the services that is needed by the patient. Okay. And so what would make this a true statement, you all? What word? Negligence is what?
Improper.
Not taking.
So yeah, so you took what you know and understood negligence was to help you figure this out. So that's what we're saying. Identify the concept, identify what you know about it to be true, and then look and put it into context. This is asking you, is this what it does it match? That and that one word, you all will it changes how you would answer. So put it into context. Okay. Beneficence. Okay. To act for the benefit or provide that support for that person. Benefit or support, essentially almost the same. But beneficent, remember, it has the benefit in the first part of the word. So autonomy, we know auto. Okay, so self-determination, that's that person's ability to decide and determine. That person self-determines what they will or will not do, or what medications or treatments they will accept. And that can change. A person can, today say, hey, yes, I want this done. But once they get a better understanding, more knowledge about something, or, then they may change. And that's okay. All right, justice. Okay. All right, providing fair and equal treatment to all clients. All right, we did pretty good on that one. Got a perfect score. All right. Now let's take what we know and put it into, we want to apply it. So you know what beneficence is. Now these are different examples. Identify what you know beneficent is and see which one of these examples matches that. We know this part of the word means to do what? Now, let's see, how did we do? We did, did we do, did anybody get, did I have it wrong? So no one answered doctor's orders or question. Now tell me, what's the definition of beneficence, you all? We act in the patient's best interest. We support them. Let me go back to the chat. Let me see what y'all put in there for beneficence. Let's see. Make sure I don't have it incorrect. So tell me, what's your understanding of beneficence, you all?
Isn't that to do good?
Mm-hmm. So you providing that support for them. So let's look back at our answer choices. Let's see here. We want to do things that's going to benefit them.
Act in the best interest of the patient.
Best interest of the patient. So let's look and see what we got. Okay, which one of these is the best interest of the patient? Doctor's orders or question, Client decides which treatment option they want. Client that goes or needs a support group and does not receive the same treatment. Lower in the bed and lowest position, call light and reach after completing care. So which one of these provide that support, make sure, and we're making sure that what we're doing benefits our patient. We're going to question those doctor's orders. Even if it's saying, the patient, remember the example that I gave, the patient has complaints of pain. They have pain medication, but the dose that that patient is on, it knocks them out. They can't feed themselves. They can't even push their car legs, almost like they're comatose. So we would bring that to the healthcare provider's attention. Say, hey, the patient's pain is controlled, but it's almost like they have a change of status. They're not able to do anything after we give them this medication. More than likely, what should that doctor do with that medication order?
Reevaluate it.
Reevaluate it. More than likely, they'll either decrease the dose. They may even change the medication, because that's a huge, you don't want that. You want people to be as pain-free as possible, but you don't want it to be to the point, if they were up and about, going to activities, watching TV, going and playing cards or dominoes, they take this medicine and they're out until the next day. They don't even wake up to eat. You don't want that. That's not benefiting them, but it does benefit them if you question and bring all that to the doctor's attention.
Professor, but doesn't also lowering the bed in the lowest position and the call light, doesn't that benefit the patient as well? Because you're eliminating the risk of a fall.
Of harm. What's to do no harm? You're exactly right. What is to do no harm?
To act in the best benefit of the patient. So
Which
in
ethical principle is that?
You're gonna lower the bed.
Which ethical principle is that, though?
Now they're gonna.
Say it again. Wait a minute.
Non-maleficence.
Yes. You see the difference? That is correct. You want to hold up on answering you all. I don't know how to pause this thing. Okay, let's just go ahead and answer. And then that way that noise won't be being made. Okay, so you're right. Now tell us that definition again. If someone's I hear some background. Give us that example that you just gave us. Come on. This is a safe space. What were you saying about the bed? So lowering that bed in the lowest position, putting that call light in reach, you do want to do that.
Yes.
You want to not cause any harm or do no harm. But that is which ethical principle is that?
Non-maleficence.
Okay. So if a patient is taking medication for pain, they're pain free, but this person was up going to activities, they were out bowling, the activity was doing, they do all kinds of things in these different long-term care facilities and adult daycare centers and things like that. I mean, they're, playing cards, they add up score, keeping score and all of that, but they take this pain medication and they can't even wake up to eat their food. So we bring that to the doctor's attention, the healthcare provider's attention. Hey, pain is controlled, but this is almost like a change in status for this person. So we are speaking up for them. It's like we're that voice for them. We're providing that support. All right. Let's see here. Our little time, y'all just run out so fast. Here we go. So autonomy. What do you know autonomy is? Now select the answer choice that demonstrates autonomy. So be able to apply what you know. Take the definition. Look and see if there are any root words in here. We know auto. We know what that means. And which one of these examples? We applying what we know. All right, we rocked that one out. A client decides which treatment options they want. They can refuse treatments. They can say, hey, I want this one. I want surgery, but I don't want blood given in the event that I have to have blood. And it's fluid. So they can even say, I want to take this medication. And then 2 months later, I want to stop taking this medication. They're expressing their autonomy, their right to choose. And we do want to support that. Oh, example of justice. I think this is our last one. Example of justice. So what do we know justice is? And this is asking you to apply. Select an example. Okay, good. Remember on the PowerPoint I showed you, I asked you which one did not. Those were examples of what justice was not. And so this one is asking you what an example of what justice is. So you all did really good. A client that goes or need a support group. For example, if they need to go to Alcohol Anonymous. They come in to the ER, they're unkept, they're, in a bad position. We don't not provide the care that we need for this person. We still provide the care that we need for this person, regardless of that. We want to be just and fair to all. So you all did recognize the concept and you all put it into context because this asks you for an example of justice. Good. Yeah, I did. That was a good catch. So that one little word, all but none, it changes the definition of what they want you, of how they want you to answer. All right, so anyone here that needs to do the weekly check-in, we can do that.